speech topic is physician-nurse communication in the emergency department. I would like you to understand the importance of effective communication and its direct effect on patient outcomes. Also, that there are challenges to this communication in this unique environment and solutions to these challenges. What would you do if you were a patient in the emergency department? Everywhere monitors are beeping, phones are ringing, staff and patients are lining the halls. There are so many people talking and noise all around. You may think, how can anything be communicated properly in this chaos? The emergency department is a unique environment. It's the site of a high percentage of sentinel events, which are unanticipated events in a healthcare setting that result in death or serious injury. Missed or delayed diagnoses in the emergency department are a leading cause of malpractice. Research shows that optimal physician-nurse communication is a key to reducing errors and improving patient outcomes. As a staff nurse in the emergency department, patient care is a priority to me. I've realized that there has to be proper and effective communication. Let's discuss the importance of physician-nurse communication, some challenges in this dynamic, and solutions to improve these communications, ultimately seeing that improving is vital to patient outcomes. According to Sherry Welch, in her article published in the Joint Commission Journal for Patient Safety, a review of the 2002 Sentinel events revealed that over half of them occurred in the emergency department, and the most prevalent causative factor was communication errors. In 2010, the Emergency Medicine Leadership Council met to address the challenge of missed and delayed diagnoses. They identified the need to improve physician-nurse communications to reduce risk and enhance patient outcomes. Each participant completed their own department assessment, and upon reconvening, every organization had prioritized this physician-nurse communication as a gap that needed to be addressed. Welch's research showed the implementation of communication processes resulted in improvements on length of stay, door-to-physician time, imaging and lab turnaround times, and a more calm environment, which all work together for great patient outcomes. Now that we understand why it's important to focus on the physician-nurse communication, let's assess some of the challenges in this environment that may cause communication breakdown. One of the challenges is the traditional and gender hierarchical gap between physicians, mainly males, maintaining dominance over the nurses, mainly females. This is contrary to teamwork. According to the Journal of Nursing Care article, The Effect of Nurse-Physician Teamwork in the Emergency Department, when team members were able to express their thoughts, they were more likely to rely on the team. This practice increased cohesiveness and removed hierarchy of feelings between professions. An article published in the Emergency Medicine Australia titled Communication Between Nurses and Physicians, Strategies to Surviving the Emergency Department Trenches states, creating an environment of shared learning flattens the perceived healthcare hierarchy between professions, and we can all learn from each other and be better for it, and most certainly our patients will benefit. Another challenge, according to Welch's Joint Commission article, shows that the ambient noise level in the emergency department is particularly high and comparable to that experienced by rock stars. Listen to this 10-second clip of a department. Communication ambiguity, where the sender and the receiver assign different meanings to a phrase, is also a common problem, such as trying to communicate a medication order and it's confused with a sound-alike medication due to the noise. Also, the sheer volume of communication information overwhelms a short-term memory, causing information to be lost before processing is complete. With the understanding of some of these challenges in communication, let's talk about some solutions to overcome communication barriers. Nurses, by comparison, spend significantly more time on direct patient interactions and can provide critical information to physicians. Physicians and nurses should introduce themselves, providing a quick overview of each role that they hold in the department. They should speak prior to patient assessments and seek ways to learn from each other. There should be structured updates between them during a patient's care. When physicians and nurses are working as a team, the hierarchical gap is bridged. Decreasing overall ambient noise improves patient outcomes. Ambient noise has a negative effect on verbal, written, and visual communication. By carefully constructing protocols, the noise level can be decreased. This may include decentralizing nursing stations. Also, departments may implement computer programs that are accessible in various areas. One of the things I prefer doing is making sure monitor settings are correct for each patient, which avoids unnecessary beeps and alarms. Physicians and nurses should strive to be direct and clear in all communications. They should not be afraid to ask for clarification. If a miscommunication has occurred, they should own it and seek ways to improve, thus preventing error. As you can see, the high-stress, chaotic environment in this department presents challenges and causes breakdowns, which leads to negative patient outcomes. Using strategies to implement solutions to improve this result in positive patient outcomes. We've discussed the importance of physician-nurse communication, presented challenges that pose problems, and discussed solutions. I hope that if you have happened to find yourself in the midst of a chaotic emergency department, that your physician and nurse are functioning as a team to better improve your patient experience and outcome.